Good evening. This is Dawood Al from the American Virginia University. Here I will highlight my final paper assignment related to the estimated healthcare cost of obesity. In fact, in the United States, the prevalence of obesity defined as a BMI more than or body mass index more than 30 has been rising for the last 5 decades and has more than doubled in the past 30 years. In 2007, 2008, around 34% of the American adults were clinically obese. And this is troubling because obesity is associated with an increased risk of many other diseases like MI, stroke, diabetes mellitus, cancer, hypertension, osteoarthritis, asthma, depression, among other conditions. Now, this brings us to study the importance of studying the cost of obesity. And when we dig deep, there are many researches that are done about the cost of obesity. In briefly, we can say that there is the causes of the cost of obesity have divided into two types, which is the direct and indirect cost of obesity. The direct costs are those that the result from the outpatient and inpatient health services, including surgery, laboratory, radiological tests, and drug therapy. This is the direct cost. The indirect cost, which have been defined as the resources which resulted from obesity as a healthcare condition, and it falls in many categories like value of lost work, insurance, wages, and indirect costs are harder to identify and measure than the direct cost. Now, if we look to the obesity, we can see that obesity costs are rising overall, and many studies support this proposal that it's increased time by time and it goes up by time. In summary, we can say and we can conclude that looking ahead, that researchers have estimated that by 2030, if obesity trends continue unchecked, like currently, obesity-related medical costs alone could rise by 48 to 66 billion per year in the United States. So, policymakers, healthcare organizations should spend more efforts in order to study the cost of obesity and the impact of obesity on the cost of healthcare system overall, and put the preventive measures and put the preventive plans in order to control the obesity to avoid the excessive rising and huge rising in the cost of obesity. Thank you.